is on the record. We are enabling everyone to record. One piece of advice is we have a hard stop at 2 o'clock today. Dr. Christ has a meeting and is managing a pandemic, so how many questions we get through will depend on how fast you ask your questions. So I will turn it over now to Dr. Christ.
Good afternoon, everyone, and thank you for joining us today. I'm Dr. Cara Christ, the Director of the Arizona Department of Health Services. I hope everyone had a nice holiday weekend this past weekend and is having a great start to the new year. This past week has been exciting. We've seen the ongoing rollout of the COVID-19 vaccine to our healthcare workers, our vulnerable populations, our teachers, childcare, and law enforcement, as well as those over the age of 75. We have incorporated over the age of 65 within our state pod, so we're very excited about the appointments that were scheduled so that we can start serving that population. As we continue to get vaccine into the state, we'll continue to expand the number of places and providers who are administering that vaccine and increase our communications about who is eligible and where individuals can receive vaccine. So we continue to update our plan for Arizona as new vaccine is approved and as we learn more from our federal partners. So I'm going to provide an update of where we are in Arizona on the distribution of vaccine and some new information. And as always, I'm going to provide a brief presentation and leave time at the end for questions. So just a quick run through our data. Our cases are still currently elevated. However, we are starting to see a little bit of a plateau. So if you'll remember, we had some significant increases 3 to 5 days after Christmas and 3 to 5 days after New Year's. We had over 58,000 and 62,000 cases reported respectively for those weeks. But in addition to seeing this plateau in cases, we are also starting to see a plateau and a decrease in hospital bed usage and COVID-like illness in our hospitals. Oh, there it is. Nope. Sorry, guys. Trying to get to the next slide. So as you look at the EPI curve, you are likely familiar with this. We continue to add new events that may impact our curve. So you can see that we, on December 17th, we started vaccinating in phase 1A. We've added the holidays so that you can see those significant jumps after each of those holidays. And again, any of the arrows that have writing in red means that that mitigation strategy is still in place. And we will continue to update this chart. This is in our weekly PDF that we post on the web. And here's our percent positivity chart. I wanted to remind everybody that this is a little bit different than what we post on the front page of our laboratory web page, but this can be found under total tests conducted. So this is the total tests conducted. The dark portion of the bars are those unique Arizonans that are getting tested, and the lighter gray bars indicate tests that were performed that week on repeats. So Arizonans that have already had or have had tests in the past. You can see the good news on this chart is for the last 3 weeks, we have seen a continuing decline in our percent positivity. So that's the measurement of the ongoing community transmission. So that is a very encouraging sign as we look to the weeks ahead. This is another chart that we put in our weekly PDF. This week it is showing some promising signs. We have 2 counties in general that are showing decreasing trend in their case counts, and then all other counties are currently in a plateau, not increasing, not yet decreasing, but all of this is positive news for the state. So now I'll provide some updates on the COVID-19 vaccine and the implementation of our vaccine program here in Arizona. Again, I just want to remind everybody that the prioritization is determined by the Arizona Vaccine and Antiviral Prioritization Advisory Committee, so VAPAC. They make the recommendations to the department, and the department adopts those recommendations. The most recent change was adding our adults 65 and older to our phase 1B population. Those individuals were eligible to make appointments at the state-run pods starting at the beginning of this week. We also post what phase each county is in and what populations they are serving. You can see that we have one county that is still in our phase 1A, so our healthcare workers and residents and staff of our long-term care facilities. The majority of our counties are serving our prioritized phase 1B, so our child care and education providers, along with our protective services occupations and those that are 75 and older. And then the counties that are in the light gray are all the way into phase 1B, which also adds our essential services and those that are in congregate settings with high-risk medical conditions. Okay. We've gone over this before, but Arizona currently follows a local allocator model. So the federal government provides ADHS with the amount of vaccine that we're going to be getting. We work with our county health departments to determine where those vaccines are going to go. They fill in what or where they want those doses distributed. We place that order to CDC, and then CDC directly allocates to the vaccine provider. Here are this week's current numbers for the vaccine allocation. By the week of January 24th, we expect to receive a projected total of 733,000 doses out of 973,000 total. And so you can see the different doses. Over the last few weeks, we've gotten consistent doses of both the Pfizer and Moderna, and that does include both first and second doses. This is the breakdown of where the vaccine is going to be allocated through the week of January 24th. So not all of these doses, I want to remind everybody, are in Arizona yet. We normally place these orders and then they will arrive between Monday through Thursday of next week. But you can see where those doses are going, including our CDC pharmacy partnership. And again, these consist of first and second doses. For our vaccine administration sites, we are very excited because we have over 400 vaccination sites that will receive vaccine this week. That includes Fry's, Safeway, and Albertsons pharmacies as well. You can go to azhealth.gov/findvaccine to identify where vaccine is located in Arizona, as well as a link to their registration site if they are using our registration. The CDC Walgreens partnership to vaccinate our long-term care facilities here in Arizona. We continue to work with them and allocate vaccine to get those high priority residents and staff vaccinated. As of last week, all of the skilled nursing facilities have had at least one visit, and they started last week our assisted living facilities and group homes as well here in Arizona. We continue to add statewide providers as we get additional vaccine. We've had over 775 providers onboarded with our program here at the Department of Health Services, and we've had 800 plus pharmacies enrolled in the CDC retail pharmacy program, which has been activated in Arizona. So as we allocate doses to that program, you will see more and more pharmacies being brought on board to have vaccine available. And that is a statewide program. Okay. Thank you, Corey. As you look at the vaccine that's been administered by county, as of today, we've had over 380,000 doses administered across the 15 counties. Each county continues to increase the allocation or the administration of vaccine. And you can see on the next chart, I can get that to go forward. Thank you, Corey. Here is the doses that have been ordered by each county, along with the number of Arizonans that have completed either a partial series or the entire series. Remember, for the Pfizer and the Moderna, it is a 2-dose series, and that So they won't be complete until they've had both doses. But you can see that we've had over 315,000 Arizonans vaccinated, and my eyes are bad, hold on a minute. 56,000 Arizonans who have completed their series, so have gotten their 2 doses. Next slide, Corey, for me. You can find out where our vaccination places are by going to azhealth.gov/findvaccine. It is an interactive map. If you click on one of the dots, it will show you where that clinic is and provide you with operating hours and any additional information if we've received it from that specific clinic. This is the cumulative doses administered. Like I said, 380,764 doses have been reported as of January 21st. And so that has been a significant increase based on the trajectory that we were seeing at the beginning. And as we add more and more sites, more and more Arizonans will be able to be vaccinated in Arizona. Just a brief update on our staffing initiative. So we are currently recruiting over 750 nurses. Approximately 650 of those have arrived. And remember, we are bringing these nurses in from beyond Arizona. We did not want to impact our current Arizona staffing. And so these are additive to our hospitals to provide the staffing that they may need during the increased usage in our hospitals. One of the things that we were able to identify is that we will have additional funding to allow nurses that are currently in place to stay on longer than their 8 weeks if they choose to do so, and if the hospital that they've been assigned to would like them to stay. So that'll provide some ongoing additional supports if that traveler wants to stay in Arizona for a little bit longer. And then thank you, Corey. So for the vaccine management system, just to provide an update, we know that there have been a lot of questions about our vaccine management system. So just to remind everybody, this ADHS worked with Google and MTX to develop this product. They were able to get it deployed in a very short amount of time. They are continuing to provide support and ongoing enhancements based on customer feedback and some of the things that we have identified to be challenges in that system as well. So some of the recent changes that went into effect either today or will be going into effect later today is an updated birthday format so that you can select day, month, and year separately. We have moved the confirm button up to the top right of the screen. Apparently that was causing some confusion with it being down at the bottom and not really being able to see. One of the exciting things, and Matt, you might appreciate this one, so days with available appointments will be identified on the calendar. So days that have appointments that are available for scheduling will be identified as green. So you can just click on the green day to make your appointment. And then one of the other things we had gotten some complaints about was that it was in military time. So going 0 to 24, there will be an option for non-military time moving forward. And one of our most exciting announcements are our second dose appointments at State Farm Stadium. So as of today, second dose appointments are being scheduled in the wellness lot before someone leaves their first dose appointment. They can choose not to schedule it right then if they want. They will still get an email allowing them to schedule that second dose within a day or two from their first dose appointment. For those that were vaccinated yesterday through this onstart of our vaccine clinic, individuals should receive an email with a link. If we don't have an email address listed for an individual, like they might not have had one, we are calling those individuals in addition to individuals that are registered under the same email address. So if you scheduled an appointment for somebody and your email address is on there, but they're a separate person, we are going to be reaching out through our call center to individuals registered under the same address to set up second dose appointments for those individuals as well. So we want to remind everybody is that if you got your first dose at State Farm Stadium, there is an appointment waiting for you. We are holding appointments for all those that have received their first dose at State Farm Stadium. And the other thing that we've heard a bit of question about and a bit of confusion, you do not need to receive that second dose on day 21. While there's a minimum interval between the first dose and the second dose that we need people to wait, there is no maximum interval. And so if you get vaccinated with your second dose on day 24, day 25, day 235, that is still considered a valid dose, and you will get that full protection with that second dose. All right, and with that, I will turn it over for any questions.
Okay, first up is Bud Foster, and a reminder that we have a hard stop at 2 o'clock today. Bud?
Thank you, Dr. Chris, for doing this. Really appreciate it. I have a couple of quick questions. First of all, on your distribution slide, you showed Pima County with 136,000 doses. Is that what we're going to get this week, or is that cumulative?
So that should be cumulative, Bud. That's the total number of doses I believe that we are going through. Let me go back and just take a look. But those should be cumulative doses through the week of January 24th. So we've received about 802,000. We have additional doses coming at the beginning of next week, so that's cumulative.
Okay, Pima County is saying that they don't believe that the distribution is equitable, that they are having a very difficult time planning because they don't know how many doses they're going to get. They send in a request, they may get it, they may not get it, or whatever. Is there any way to make the distribution into the counties outside of Maricopa County, outside of Phoenix, more equitable?
So we are basing our allocations on the population of the priority groups that they are in. So we are dividing that out based on what Pima County's population or what some of our more rural counties may have. What one of our limiting factors is the amount of vaccine that Arizona is receiving from our federal partners. We have asked for increased allocations, but what we want to reassure everybody is that the allocation for State Farm Stadium is not cutting in to other counties' allocations, but individuals from other counties are eligible to come up to State Farm and get vaccinated there.
Okay, one quick question as well. I'm getting a lot of questions about why can't I walk into a Walgreens or a CVS and get my vaccination the same way I get my flu shot? I tell the people it's because of the limited number of doses that we have. They don't seem to be satisfied with that. What would you suggest that I tell these people? We are doing a program tonight, and I'm going to pass this information along to the community. What would you like for me to tell the folks in Tucson?
So that's our hope too, is to be able to have people walk into a pharmacy and get this vaccination just like they get their influenza vaccination. So we activated our retail pharmacy program with CDC last week. And over the next few weeks, we'll be building up additional pharmacies and adding over 100. So I think this week we're bringing online about 59 pharmacies, and that's Fry's, Safeway, and Albertsons pharmacies. You'll be able to find those locations on azhealth.gov/findvaccine. And we will be adding more. CVS and Walgreens are pretty busy with the long-term care pharmacy partnership. And so that's why they have opted not to activate and have it in their stores. But we are hearing that they're interested in activating soon and getting more vaccine.
All right, thank you very much. I really appreciate it.
You're welcome.
Okay, next is Cameron.
Hi, Cameron.
Hi there. To continue with that actual line of questioning with long-term care facilities and assisted living homes, we're told by CVS that obviously what you were saying, that you activated that program for assisted living homes last week. Was there a reason why you waited until last week instead of giving them a go-ahead when you gave them a go-ahead with the long-term care facilities? And I asked that because they said that they could have actually already have started long-term care facilities before you actually gave them authorization. They had the supply. So why wait if that's what you chose to do, or what happened with that whole thing? And I'll have another question too.
Yeah, absolutely. So with the CDC pharmacy partnership, what the state has to be able to do is take a pretty significant proportion of the vaccine just right off the top. And once you agree to giving that vaccine, it comes out in like it's 50% of the doses that they need 1 week, 25%, 25%. And then when you activate phase 2, they do the same thing. And so we wanted to make sure we activated immediately the skilled nursing facility, which is our highest acuity long-term care facilities in the state. Once we were guaranteed that we would have ongoing vaccine and we're finished with, the other parts of our phase 1A and ready to move into phase 1B, that's when we activated the assisted living, because they do take a significant portion off the top that Arizona does not see in our allocation.
Can you send them a message quickly before I get to my next question? Because we have a lot of folks who are living in those assisted living homes and who are seeing everybody go and take vaccines at large facilities like State Farm Stadium, and they know that supply is limited. So they're very worried about that vaccine getting to them. Can you respond to them right now?
Yeah, absolutely. So because those that were in skilled nursing facilities and assisted living facilities are such a priority, that's why that vaccine comes off the top. So their vaccine is already secured. CVS and Walgreens have the vaccine that they need for that program. So what is going on in the community is not taking those doses away from anybody in one of those long-term care facilities.
And no regrets on starting it earlier, giving them the go-ahead to get started before Monday?
So looking at the way that the appointments were scheduled, they just finished. I believe it was the week before we activated the phase 2. They had just finished the long-term care facilities or the skilled nursing facilities. And we were not aware that they could have started that earlier. So we're trying to get them as much vaccine as we can and keep the allocations for our other priority populations as well.
Second question, we just heard from Maricopa County that they say that basically advising folks who got their vaccinations at the pods who haven't received their second dose yet, that they can't schedule any more appointments due to supply. And they're actually advising folks to possibly look elsewhere, including State Farm Stadium. So we have a lot of people worried that this doesn't guarantee my second dose, basically. I know that you talked about the interval. Obviously, I know that people were seeking some information on that, so thank you. But what about, are you able to guarantee their second doses, or is the state going to help the county make sure that those second doses are given in a proper time?
So the ones that I can guarantee are those that will be vaccinated or have been vaccinated at State Farm Stadium or the upcoming Phoenix Municipal Stadium site, because we've built our system to accommodate those second dose appointments. We've been hearing the same thing from some of the county pods as well. We have been, if we have availability, we have been trying to accommodate those second doses at State Farm Stadium as we can. And I do know that people who had registered for their first dose at one of those other pods were able to get appointments at State Farm for their second dose. So what we would recommend is continue looking for additional appointments. We are hoping, if we get more vaccine, to open up more appointments at State Farm Stadium or the Phoenix Municipal Stadium. And if you received Pfizer vaccine for your first dose, they're more than welcome to apply for an appointment at either one of the state-run pods.
Okay, thank you. Katie Davis-Young.
Hi, Katie.
Hi there. I was asked a question about, obviously tens of thousands of people with appointments now, and COVID is still widespread. So what is the guidance if you test positive for COVID before your vaccine appointment? Are you putting the vaccinators at risk if you show up? Are you supposed to cancel?
So we would recommend you don't need to cancel as long as you are not actively ill with a fever or significant symptoms, you are still able to get vaccinated. We would recommend, and people have been doing a great job of this, but wearing your mask when you are there. That is one of the reasons, that we all of our volunteers have PPE. That's why we like the drive-through method, because people don't have to come in to quite as close contact. But we would recommend it does not change our recommendation for getting that vaccine.
I also wanted to ask just really quickly, looking at the reports that come out every day that show the amount ordered, it's 800,000 some now compared to 300,000 shots that have been given. I know that ordered amount accounts for second doses. Is it always going to look like you've only used about 50%, or how should we interpret those two numbers?
That is a great question, because how you interpret those numbers are going to depend slightly on what day you're looking. So, we place orders at the end of the week. We know that they're not going to get here. So you may have some overlap where it's looking like there's a whole bunch of doses because they've been ordered, but they haven't arrived in Arizona. The other thing that we are looking at, we know that we've got some areas where we need to catch up with providers on doing data entry to make sure that they are reporting to the state. And we are looking higher than what CDC is reporting for the state administered. So we're working to identify where some of those gaps are. Probably what you want to look at is the increase between each day versus how much is ordered.
Next, Valerie Cavazos.
Hi.
Hi, thank you for answering my questions here. It's twofold. I have one question about logistics and the next question about education.
Yeah.
Pima County has told us that they're concerned about the vaccine supply, not knowing when the next shipment is coming in to service the community. And the health department cites making daily calls to find out. Can you please walk through the logistics of how the supply and communication is handled between the state and Pima County?
Yeah, absolutely. So we get our allocations here on Tuesday or Wednesday. That's when they get loaded in, depending on the vaccine. And then we put it into the allocator tool that goes to our county health departments so that they can see how much of each dose they're getting, what their estimated population is at that time. And then the counties normally have a day or two to get the vaccine orders back to ADHS. And so ADHS, then once we get everybody's orders, we upload them into the CDC's ordering system so that then they can get the vaccine ready for shipment, and the shipment then goes out to the sites. Once it goes back out, the Department of Health Services, like once CDC gets our order, we don't get a lot of great information unless it's doses that we've ordered for like the state pod on the shipping distribution. But they tend to come in Monday through Wednesday or Thursday of the next week. But yes, that has been a little bit of a challenge because they are being shipped directly from the manufacturer or McKesson directly to the provider. Now, the provider should get a tracking number, I believe, that's specific to that provider.
Okay, the other question kind of piggybacks off that. The concern over the lack of supply when they're coming in, Pima County pulled back on the number of educators that would receive the vaccine this week because of the concern over supply and the overwhelmed system over here. Is there any collaborative work to help the counties and the districts to get these schools reopened, because that's the major plan here, and teachers are kind of wondering about that as well.
So we are working with our county health departments on their accelerated plans for vaccinating within their jurisdiction. We have made a federal request to our federal partners for additional vaccine, and continue to wait to hear to see if Arizona will be eligible for that vaccine. What we do try to do is, as we're looking at the allocation, we see if there are ways that we can help them potentially achieve a plan or identify where doses may not be being used or look like they're not being used, so that counties can reallocate maybe from sites that aren't potentially as effective to other sites within the county where they could utilize that. So my team does provide technical assistance on those types so that they can continue to vaccinate, especially those high priority groups like teachers, because yes, that is a major goal of the state, is to get teachers and kids back in the classroom.
One last question, very quick.
Yeah.
Would you say that communication is good between Pima County and the state?
You know, I always think that everybody can improve on communication, but we have twice weekly calls with all of the counties. My team does. In addition, I know that the Pima County Health Department is very active in emails and texts to my team when they have specific questions. They know that they can reach out at any time when they need more information than what's just in those twice weekly calls.
Okay, appreciate it. Thank you.
Thank you.
Howard Fisher.
Hi, Howie.
You know, it wouldn't be Friday if we didn't meet like this. So let me turn a little bit away from the vaccines to the virus. You know, we had 8,000 deaths on December 27th, 9,000 on January 1st, 10,000 on January 9th, 11,000 on January 15th, and 12,000 this morning. I appreciate all you've said about the real key is, you know, washing your hands, wearing a mask, social distancing, not gathering in crowds. But given those numbers, is there not a single thing that you think needs to be changed on mitigation? Nothing at all that you think would be appropriate?
If I was able to make a recommendation, my desire would be to have local enforcement of the mitigation measures that are currently in place. That has been one of the things that would be very helpful, you know, mandating masks, enforcing the mask use, enforcing physical distancing, enforcing the limitations on occupancy that are in place right now. That would be the most helpful thing.
So you're telling me that local health departments can't enforce this? This is all, what, DLLC, liquor department, and everything else? I mean, I'm not sure I understand.
Yes.
What's falling down there.
So local health departments and local government jurisdictions do have the authority to enforce these. We work very closely with DLLC on our enforcement at the state, but it would be helpful to have more eyes and ears on the ground helping us enforce the mitigation strategies that are already in place.
But you don't see anything additional?
You know,
we keep beating to death the statewide mask mandate. You know, people have suggested, look at what CDC is recommending. You know, maybe some closing down some bars and restaurants for a while, or closing them down early. Travel restrictions. Anything else to kind of put a pause in this? You don't see anything here that's necessary?
So bars should be closed, Howie, unless they're serving as a restaurant. So, and then they're supposed to be at reduced occupancy and enforcing masks and those types of things. Obviously, we are finding that just this week we shut down a facility for not following the mitigation strategies. But it would help to have more eyes and ears out there helping us do that.
So nothing at all. You know, I know you're a good loyal soldier to the governor. Nothing at all you would recommend to him. It'll be just between us.
Yeah, yeah. You know, as you look at what places like California who have severe, you know, lockdowns and restrictions and mitigation strategies in place, or New Jersey and New York, they're experiencing what we are experiencing. I mean, I don't want any Arizonan to get any of the infectious diseases that we monitor. Unfortunately, this is a very contagious disease. And so, you know, we encourage those same mitigation strategies. I follow the mitigation strategies. I do see others who are out there that aren't following the mitigation strategies, and I wish everybody would.
Okay, well, I keep trying.
Thanks, Howie.
Okay, a reminder, we have a hard stop at 2 o'clock.
Yes.
Ryan Knappenberger.
Hi there. I haven't done this before, so I thought I might introduce myself. I'm Ryan from Cronkite News.
Hi, Ryan.
And my question is regarding So this week on Wednesday, the Biodesign Institute at ASU held a meeting, and Dr. LeBaire, the executive director, said that COVID-19 is on track to become the leading cause of death in the state of Arizona, compared to, or passing, I should say, cancer and heart disease deaths. So my question is, based off of this projection, do you think, is that being taken into account in the department's reaction to, to the virus, as well as specifically to the vaccination distribution, if there's any considerations being taken there?
So, that's a really good point. And I think that part of the decision-making for adding those that are 65 and older to our prioritized phase 1B, because we know that the majority of deaths for COVID are occurring, and hospitalizations are occurring in those that are 65 and older. So that's why we wanted to make sure that we were bumping up that group. It was consistent with the Centers for Disease Control and Prevention's recommendations, but really getting them into this priority group for getting vaccinated, because that definitely can save lives.
Okay, next up, Eric Fink.
Hi.
Hey there, Dr. Chris. Thanks so much for taking the time.
Yeah.
Yeah. So just to kind of get some clarity, earlier this week, Dr. Garcia here in Pima County said that the statewide strategy was favoring the big population center, Maricopa County, Phoenix, at the expense of Pima and smaller counties. And I wonder what your response is to that.
Well, I guess the response, so there are the two types of different vaccines. And so as we look at vaccine allocation statewide, we are using the Pfizer vaccine for our two most populated counties, which are Maricopa and Pima. And that's because Pfizer vaccine is very, very finicky. It requires very stringent storage, temperature requirements, as well as is only good for 6 hours after you reconstitute it. So make it so that you can inject it into somebody's arm, which is not good unless you've got some of these mass vaccination pods. Our local county health departments had actually asked us to be able to use Moderna, which just requires a regular freezer, does not have quite as much storage or temperature requirements. And so our 13 of 15 counties, unless they've asked for a very, very special one-time Pfizer allocation, have requested to only get Moderna. And so we are honoring that. Moderna is not being used at State Farm Stadium or any of the state-run pod sites. And as we look at the Pfizer allocation, the doses for the state-run are coming out of Maricopa County doses. So they take a whole allocation, we look at that, we use some for State Farm, and give the rest to Maricopa, which does not impact Pima County's, allocation at this point. What we would recommend, we are working very closely with Pima County. Pima County has developed a plan, has asked the state not to set up a state-run pod in Pima County. They are adding a couple of pods as well as extending hours. However, that's always something that we are welcome to offer as we get additional vaccine in the state.
So far, you've been at this now about 5 weeks or so. Yeah. What do you think the biggest hurdle for you all has been?
I would say the biggest hurdle is, sorry, I'm adjusting my mask. I would say the biggest hurdle is the amount of vaccine that is coming into the state. I think if we had enough supply, and we knew that it was going to be limited quantities at first and that the demand would exceed the quantities. But just from the state-run pod perspective, at State Farm, we've got 6,000 doses a day that we are doing. When we truly have a capacity to be able to vaccinate 12 to 16,000 people a day there. We're starting Phoenix Municipal Stadium with very, very few doses because of the limited supply. And that has the same ultimate capacity as State Farm. So we could be doing 24 to 30,000 Arizonans a day if we had sufficient vaccine quantity. We also know that this is now a plug and play playbook. So we could set up, state-run pods in Coconino, Pima, Yuma, La Paz, if we had the doses to do. We set up, from the time I said go to the time State Farm was operational was 6 days. So we know that we can spin them up quickly too if we have vaccine.
And you have made a request to the federal government for more doses. What does that look like? I mean, what are you looking for? How much are you hoping to get?
Yeah, so we did. Yeah, we put in a federal request. Our request was put in last weekend. We asked for an immediate emergency dose of allocation of 300,000 doses, with an ongoing allocation of an additional 300,000 doses per week. So we asked for a significant increase. If we're getting about 84,000 doses a week, that would be a significant increase. And that was after looking at the major counties' plans and seeing how many doses they would need to support their future plans, so without causing them any vaccine limitations or supply limitations.
Lastly, thank you so much for taking the time. Lastly, any thoughts? We saw an email come in today that the state has approved dozens of licenses for marijuana dispensaries, recreational dispensaries. Any thoughts on that?
Yeah, so we did approve, I think it was approximately 73. It was, so we approved licenses for adult use marijuana and the sale of those products. Many of those were were existing medical marijuana dispensaries, and so we were able to get their licenses approved. So it's an exciting step for those that want to participate in that program.
Thanks, Dr. Chris.
Welcome.
Peter Seymour.
Hi, Peter.
Hello, doctor. Good afternoon. So we were talking about limited supplies. Pfizer, by the way, I have 3 brief questions. Pfizer is offering to sell COVID-19 vaccines directly to states, bypassing the federal government, perhaps to get more doses out faster. What do you think of all of this?
So yeah, we heard that information as well, and are looking into it. That could be exciting. I know that some of the funding that we've gotten, like from CDC for vaccination efforts, prohibits us using our funding for the sale or for the purchase of vaccines. So it's something that we're looking at, and it could potentially add additional doses.
Okay, so it's just very restrictive at this point, and I think only the feds can do the purchasing and distribution. So I'll follow up on that later. Is Health Services now tracking more people who have tested positive for COVID-19 more than once, so twice or even 3 times?
Yeah, so those aren't, the cases would still be indicated. So say somebody gets reinfected and has it greater than 90 days. Those cases would be counted as a case in our dashboard, but we don't specifically call out reinfections in our case counts.
Why is that?
It's difficult because what needs to be done is a lot of back investigation to make sure that they actually did clear the virus, that this is a new infection and not an ongoing infection. There's just a lot of medical history that needs to be done to confirm that they are actually another case.
And then Dr. Marjorie Bessel at Banner says her hospital network is giving out monoclonal antibody treatments. Is the state doing this anywhere? Others doing this anywhere? And if yes, how many doses have been received and given out?
Yeah, so we can get you that number. I think if you go to, it might be phe.gov, which is the federal government's allocation of the bamlanivimab and the Regeneron. So those are both monoclonal antibodies that are actually allocated through the state health department to providers in our community. So we've been partnering with hospitals, as well as outpatient treatment centers and other urgent cares in order to get them the monoclonal antibodies that they need to treat people. Usually that is a treatment that you want to use very early on, right after diagnosis, for somebody who is not experiencing hospitalization requiring symptoms, but before that happens to prevent hospitalization. So we are partnering with Poison Control to set up a system that will allow outpatient providers, if they have a patient they think fits the risk factors and the indications to receive those monoclonal antibodies, to identify where they are being where those are being administered so that they can direct their patients there and work with that provider for treatment. And so, yeah, this is something that the state is actively engaged in and coordinating from a statewide basis.
And if the state gets to buy vaccines in the future, how would you ensure equity? How would you ensure that there's not a price war? This is some of the criticism that's been received already. How do you prevent all of that?
Right. I think that those are great questions. You know, as we were bringing in nursing from out of state to help assist with this, you know, the surge and getting that staffing initiative set, you know, we were competing with other states for those same limited resources, and it does turn into a war. We're hearing from some of our providers that they're losing nurses because the traveling nurses, like we're losing Arizona nurses to California because California is just paying so much to get them out there. So you know, these are all really good questions that I think need to be addressed from a national perspective to prevent those types of things from happening.
Thank you, Dr. Chris.
Thank you.
Nicole Gregg.
Hi, Nicole.
Hi, Dr. Chris. Thanks for taking some questions. I'll try to go quick since you have to be out at 2 and there's others with their hand raised.
Yeah.
So I added up the doses that you're supposed to receive next week. It's 169,000 or so. Is that guaranteed next week? You said you asked for 300,000. So that's more than 100,000 less than what you really needed. So are you talking to the Biden administration? What has their response been? And are you concerned about just getting the 169 when you ask for 300,000? And I'll have a follow-up.
Yeah, absolutely. So actually the 300,000 would be in addition to our ongoing allocation. So we would like 469,000 if our request was fulfilled. We work very closely with some of the career professionals at HHS and FEMA to get our requests. We have been advocating for over a week to get these requests. I know that they are looking at State Farm as kind of a model for the 24/7 vaccination site. I just think that they're dealing with vaccine limitations across the country, but it is something that we are strongly advocating for because the 169 just keeps our current activities going. The 300,000 additional doses would really ramp us up a lot.
Okay, and then with the second appointment, you know, Maricopa County, like Cameron asked, people don't have a guaranteed second appointment now. You said that you suggest that they check sites like State Farm to get their second dose, but the reality is there are no appointments. So why is that your solution to people, telling them to go check, you know, on State Farm when there are no appointments? And then just one last question and then I'm done.
Yeah, absolutely. So that's a great question. So what we're hoping to be able to do is as we get additional doses, we are going to try and open up more appointments. So say next week they come up with the 300,000 additional doses that we ask. We're not going to wait until February or whenever that comes. We're going to start opening up appointments, but we will make announcements as we do that. I know that they are also looking at some of those county pods to identify if they get additional vaccine. Now, the second doses for those should be going to those sites for them to provide that second dose. So they may be waiting to ensure that they get those vaccines before opening up appointments for those second doses. So we are working to identify if there's a way that we could do that. And if we got additional doses at State Farm, you know, we would be happy to take second doses where people weren't able to get appointments at other places.
Thanks for that. That helps a lot. And just my last question,
Yeah.
you know, just from, you know, the outside, and all these counties are begging for vaccines, and then they see the State Farm 24/7 giving out so many vaccines, so successful. Is there kind of a greed thing here? Are you keeping back more for the state than you're giving to the counties?
So we are taking a portion of the doses from Maricopa County in order to be able to do that. But what we were seeing was statewide, initially our vaccine distribution wasn't as fast as we needed it to be. And we knew that our, the systems that stood up the pods were using their current healthcare providers to staff those pods. And really what we needed was a solution that could really accelerate that. And so that was, at the, I'm going to accelerating the administration of the vaccine was a request of the governor, because we agree it just wasn't going fast enough and it needed to go faster. So, whatever we need to do to get vaccine out of storage and into the arms of Arizonans, we're going to try to do as quickly as we can.
Okay, Amanda Morris.
Hi, yes.
Hi.
I'd like to ask a question about the fact that this Tuesday is 1 year since we've had our first COVID case confirmed in Arizona. And I wanted to ask kind of a threefold question. So I'll just spit it out and then you can address it one by one. But basically, looking back on the past year, what do you feel like we've learned? What do you think we could have done differently? And where do you think we go from here?
I forget questions very easily, so I'm just writing them down. So looking back at the past year, it's, I think everyone agrees, boy, it's been a long year. We activated our Health Emergency Operations Center on January 26th of last year and have been in, full HEOC mode since then. I think, one of the learning points has been to remain humble. I think, every day we are still learning things about this virus, and this virus is challenging us in ways that, it with the variants and the vaccine and reinfection and the way that it's transmitted and all of that. I think that that's a learning opportunity moving forward, because I think we all thought that the next pandemic would be influenza. And looking back on that, what would I have done differently? Encouraged public health to take breaks and encouraged public health to do that self-care, because I think we've just been going and going and going. We've been fortunate here in Arizona because a lot of our public health systems are still intact and still have the phenomenal leadership that our local levels have had. And I think that that's a really important thing, because a lot of states have not had that. Where do we go from here? I think that, encouraging people to make sure that they're wearing those masks and following the mitigation strategies and getting their vaccine, I think is really, really important. And the vaccine's really what's going to bring us back, not immediately, but, several months down the line to some sense of normalcy. But I also think changing the expectations, and this is a conversation that I actually have with my 13-year-old, is that it's not probably going back completely to normal. And so, setting that expectation moving forward that it's a new normal and it'll get closer back to where we were, but it might not be back to what we were used to prior to the pandemic. And I think that's it's a hard thing to kind of think about as you move forward.
Okay, we're about 5 minutes from the end. Colleen?
I'll keep it very brief. Just following up on Cameron and Nicole's questions, with the limited supply from the county, is it kind of causing a ripple effect in the limited supply of vaccines that Maricopa County is experiencing, and you're taking on second doses for people? Is that going to then cause increased limited supply as you're waiting on the federal government to give more doses?
Yeah, so, they've identified how many are second doses and first doses, and we have been keeping that allocation and trying to keep that intact to the counties. Making sure that people get their second doses is important, because we know that people aren't going to be fully protected until they get that second dose. We are trying to prioritize those second doses while getting out the first doses as quickly as we can, but it all could be a limiting factor because we were under the understanding that there was second doses being held, pulled off the line and reserved, and that does not appear to be the case. And so we continue to work with our federal partners on how to move forward, but we need more vaccine, and that's what we have been advocating with our federal partners for the past, I would say, 10 days strongly.
Okay, Nicole Garcia.
Hi, Nicole. Oh.
There we go.
Hi, can you hear me now?
Yeah, now I can.
Really quick, so we're limited vaccine, but then there's these pharmacies that are going to start administering. So realistically, when do you think people can start making appointments to go to their grocery store pharmacy or other type pharmacy? And so are we just waiting for more vaccine and that announcement to be able to make those appointments at the pharmacies? And would those appointments still be made through the AZDHS site?
Right. So those are great questions. We will continue to add pharmacy sites and allocate doses to the pharmacy retail program. So some people, if they've got a Fry's or a Safeway or an Albertsons that they go to and they do have vaccine, could make those appointments potentially this week, depending on how those pharmacies are setting up their operations. We will have the link on our website, but I believe that they are not going through our appointment scheduler, but you will be able to find the link to any kind of registration or appointment scheduler that they might have. And you'll be able to find them on our map. We will include all of those locations on our map moving forward so that people can identify if there is vaccine at those specific pharmacies or not.
And then my other question about enforcement, you said you needed it would be nice to have other set of eyes. Well, when I call local law enforcement, they direct me to the county, then the county directs me to the state, and then I go back to local law enforcement, and basically, some of them have told me they're on an education process. They're not citing anybody for not wearing a mask or this and that. It appears to me there needs to be some type of state mandate to have the local law enforcement be more forceful in enforcing. Does that make any sense? I mean, it's just a big circle when you were talking about enforcement. How do we fix that?
It is. And so Governor Ducey, in his executive orders, did give local law enforcement as well as health departments and regulatory agencies enforcement authority to be able to all the way to shut people down for not following the mitigation strategies. And so really the decision like for potential law enforcement or local governments would be, how they wanted to proceed with that mitigation and with enforcing the mitigation measures. We are operating at the state on a, 2 strikes, you're out. So we go out, you're not following the mitigation strategies. We give you a couple of days to a week to bring those back. We go back out. If you're not following those mitigation strategies, they will be shut down. And so unless it's so egregious that we go out and just shut them down the first time. Encouraging people to follow that through their local government.
Good afternoon, Dr.
Oh, there
Chris.
you are.
Yes, hi. So I know that I think Bud and Peter both made points about equitable distribution of this vaccine. In that same vein, we've heard quite a few concerns this week from people who have had trouble navigating the website to book an appointment and from people who have been put on hold for several hours when they call in to book. We know that people in low-income communities in particular don't necessarily have the luxury to be in front of their computers for several hours or be on hold for several hours to book an appointment. Can you talk about how the state plans to ensure an equitable rollout for low-income and rural communities as the vaccine becomes available to more groups? Are there plans to have, mobile clinics or distribution methods that won't necessarily require appointments?
Yes. So the ultimate goal is to move away from these big mass vaccination pods as vaccine becomes more available and move it into exactly what you're talking about. So using pharmacies, using doctors' offices, using mobile clinics that can go into communities so that communities that may have less mobility, may not have access to internet, can just go in without an appointment to get it. As we continue to increase the places where those providers are, that will become more and more of a reality. And that's our goal, is to get it out and as easily as accessible as influenza virus.
Okay, everyone,
All right.
it's 2 o'clock. I'm sorry. Those of you who have your hands up, please reach out and we will help you offline.
Yes,
Thank you,
thank
Dr.
you.
Christ, for your time. We need to get you to your meeting, and thank you, everyone, for participating.